Hi everyone, today I'll be presenting on question 4, which is a case about Bob. I have made and printed out a find a word of the key words in this presentation to keep you entertained. We have Bob, who is 20 years old, presenting following a heavy trauma. His left femoral shaft has been broken into 2 pieces, and although the skin is intact, surgery is needed to align the bones and facilitate healing. Part A asks us to describe Bob's fracture using our knowledge of fracture classification. From the given history, we can tell the femoral shaft has been broken into 2 pieces, indicating it is a complete fracture. And the fracture is displaced as he needs surgery to align the bones for healing. As Bob is young, the fracture is most likely either an oblique or transverse fracture. However, it is difficult to rule out which type of fracture it is, as we are not given information on whether the trauma occurred perpendicular to the bone or at an angle. Unfortunately, bone union is delayed, and Bob develops a temperature of 39 degrees and has to return to hospital for intravenous antibiotics. Name the likely condition that has occurred in his left femoral shaft and explain the pathophysiological process that has occurred. Bob has most likely developed osteomyelitis, which is an inflammation of the bone and marrow caused by an infection of the bone and marrow. Typically, osteomyelitis is transmitted by either direct inoculation of bacteria or blood-borne organisms. In this case, it was not an open fracture, so we can deduce the infection was caused by the surgery or during the post-operative period. Bob's site of injury was exposed to bacteria at some stage, most likely Staphylococcus aureus, and this infection is exogenous as it has originated from outside the body. Staphylococcus aureus is a common bacteria found on the skin, nose, and GI tract. It is commensal in nature and an opportunistic pathogen. The proliferation of bacteria will trigger a cascade of inflammatory pathways involving interleukins and other cytokines to the site of infection. Inflammation is an immune response used to remove damaged tissue components to allow the body to heal. It is initially characterized by vasodilation and an increase in blood flow to the affected area. This is followed by an increase in blood vessel permeability, allowing fluid, white blood cells, and proteins to migrate from circulation to the affected site via chemotaxis. This accumulation of fluid and other biological substances to the injured site is what we know to be swelling and edema. Inflammation and edema in the medullary cavity will take up space and invade into the outer cortex, where the blood vessels are present and can be compressed. This can lead to ischemic necrosis of the bone, known as sequestrum. Infection can also spread outwards from the bone and form pus deposits known as abscesses under the periosteum. This can spread to nearby tissues and drain through the skin. Subperiosteal abscesses elevate the periosteum, decreasing blood supply to the bone, causing sequestrum. However, the elevated periosteum will stimulate osteoblasts and form new bone encapsulating the infected bone. This is an involucrum. It is important to note that the areas of dead bone and surrounding tissue can be difficult to treat, as it is difficult for the immune system and antibiotic treatment to reach it. Bob's left knee now becomes acutely swollen, and the orthopedic surgeon draws out pus from the synovial cavity. The surgeon immediately returns Bob to surgery. Explain what has happened and the underlying pathophysiological changes that could occur in the knee if not treated immediately. Pus in the synovial cavity indicates that infection has spread from the bone into the joint and has progressed from osteomyelitis to septic arthritis. This could be due to antibiotic-resistant infection. Staphylococcus aureus is known to be good at adapting and evading antibiotic therapies and is a good example of antibiotic resistance in healthcare-acquired infections. To treat this condition, the orthopedic surgeon would need to use techniques to try and remove as much bacteria as possible by decontaminating the site of infection and trying to prevent new bacterial growth. Depending on the condition and severity of the infection, different surgical interventions may be chosen. The most common include closed needle aspiration, open drainage, tidal irrigation, arthroscopy, and arthrotomy. However, if septic arthritis remains untreated, it can have poor consequences on the joint, where enzymes and toxins from bacterial lysosomes cause collagen destruction, particularly affecting the cartilage and synovial membranes, causing rapid joint destruction. Swelling of the joint will cause an increase in intra-articular pressure, further compromising blood supply to the joint. The damage can extend to destruction of cartilage and epiphyseal plates, which can hinder bone growth and development. This can result in a narrowing joint cavity and erosion of the joint, affecting articulation, and over time, if left untreated, this can manifest into osteoarthritis. Alternatively, if septic arthritis is not treated, the infection can spread to other parts of the body via blood, a condition known as sepsis, which is life-threatening. Here are my references, and thank you for listening.